Medicare is in financial trouble, and the federal government really hasn't done much to take action to help get it out of that trouble. We know that there will be 15 million uninsured added to the Medicaid program nationwide if the new law is effective. But what we also know is they plan to take $500 billion, or $500 billion from Medicare to help pay for that. So we're all concerned because the program has an incredible unfunded liability as it is. Last week on April 1st, all of us sustained a 21% decrease in the fees that are paid to us for taking care of Medicare patients. And that decrease continues. Now, frankly, there will be extra Medicaid patients added in the state of Texas, and already we have concerns about the ability for them to see doctors because it's hard for a doctor to afford a patient group that has a heavy Medicaid population because it doesn't pay to keep the doors open. There are over 2.5 million people in Medicare in the state of Texas, and 800,000 members of the military and that family under TRICARE that depend on a Medicare program for their health care access. We love our Medicare and TRICARE patients. I have been practicing in Austin for 33 years, and I don't want any of them not to be able to come to me because I can't afford to have them in my practice. Right now I'm holding strong, but you see all four of our doctors here are in specialties that have a high Medicare population. And we're just concerned that unless something is done, we're not going to be able to provide the same access and the same technology to this group of patients who've been, I'm working on my third generation here in Austin. So it's very disturbing to us, and the SGR problem that I told you about, the fee cuts, was a problem that the federal government actually created. And they ought to be able to solve this issue since they created it. And if they can't solve that one simple problem, do you think they can take care of our whole medical system? We're really concerned.